Today we are going to discuss another topic from the Oxford Guide and Gynecology, Gynecology, that is the uterus measurement anomalies. So before going through the uterus measurement anomalies, we have to know that what does it mean, the measurement of the uterus, and how we can measure the height of the uterus. So there is a method called as the symphysis fundal length or symphysis fundal height. As I draw here in a red pen, that here is the point PS. S means the pubic symphysis and F the fundus of the uterus. So when the mom pregnant and the fetus start to grow, the uterus start to move up side of the body. So as the week of 16 it reaches in the midline, in the middle of the line from umbilicus to that of the pubic symphysis. At the week of 22 week of gestation, the fetal height and fundal height it reaches to the umbilicus of the pregnant lady. And the week of 34, the height of the fundus reaches to just below the sternum. So with age, the fetus grow, and that pushes the uterus up and grow till to the sternum. Okay, till to the stern sub xiphoid process or subcostal area. So there are many things which what they do in those conditions. Either the size of the fundus it go above the estimated level regarding or comparing with the uh, week of gestation, or below. For example, a pregnant lady will come to you, and when you find the fetus, the height of the fetus is at the level of umbilicus, and the gestation period is 34. So it is what? It is a anomaly, and it is not a normal condition. So uh, in that condition, we need to think that why this lady has a low uterus. So we will discuss all those abnormalities and all those conditions which cause the rise above of the fundus and below of the fundus regarding the week of gestation. So the uterus may appear small for the date because of it means that why the uterus become below the normal line of the pregnancy, why it will come down. So the causes that wrong date, if you uh, measure the estimated date of delivery wrong, then definitely the size will up and maybe down about from the normal line. Oligohydramnios. Oligohydramnios is a condition in which the amniotic fluid will be less. So whenever there will be less amniotic fluid, less pressure exert on the wall of the uterus, the size of the fetus will be small, and now the fetal height will be less. Intrauterine growth restrictions. So if the fetus is not growing properly, there is some defect into the fetus, okay, which restricted the fetal growth. So in that condition also the fetal height will be the uterine height will be less. Presenting part deep into the pelvis. If the fetus is deep into the pelvis, so definitely the uterine fundal height will be less. And an abnormally lie of the fetus. If the fetus is lying abnormally, for example, if it is in transverse position lying, then the fetus will be low. Okay. And what are the anomalies which causes the fetus to grow more than that of the normal line? The uterus may appear large after for the dates because of wrong dates. Again the same. Macrosomia. Macrosomia is a condition in which the size of the fetus become increase more than the expected size. So in that condition, the fetus will push the uterus and now the height of the fetus, height of the uterus and the fundus will more than that of the estimated line. Polyhydramnios, if there is more amniotic fluid around the baby, then it also push the uterus. And multiple pregnancy, if more than two baby, then definitely the size of the uterus will be increased. And presence of fibroids, if there is some cancer or some other thing, other mass, in that condition also the fetal height will increase.